mentality to actually go to a doctor only if they have symptoms is actually an old-fashioned mentality. Our lounge is also catered to those who are working, and if you don't give your body proper care that it needs, sisingilin ka later on. You have all this money because you've been working and working. Ubus ka agad your inipon mo.
Good day, everyone. I'm Dr. Jing, and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts.
Today, in celebration of World Health Day, we're diving into a topic that affects us all: preventive healthcare and the vital role of executive checkups in keeping us healthy. Joining me is Dr. Rowena Ejercito De Jesus, a trusted expert from St. Luke's and also the head of Wellness Center of St. Luke's, and she's here to share valuable insights with all of us. Welcome, Dr. De Jesus.
Thank you, Jing, for inviting me here.
So, World Health Day is a global event. Would you be able to give us the significance why this is celebrated or recognized?
World Health Day is actually more of giving awareness to health and wellness of every individual. People usually think that they will only consult doctors when they're not feeling well. That's when they think that they actually have certain conditions. But there are a lot of medical conditions out there that do not have any symptoms. So raising health and wellness and making sure that when you check your overall status, your health, it will prevent any condition that can happen. It can also help catch early diseases, which will actually impact in the long-term management or outcome of a certain individual. That's why World Health Day is very important to actually promote in awareness for all patients or all people, not just patients, but all people. Yes, all individuals.
It is said that prevention is better than
Cure, yes.
And you mentioned, Doc, that there are people who think that we only need to go to doctors when we feel unwell, no? Or if we are already seeing a bukol or talagang masama na yung pakiramdam, no? So, Doc, when do you usually advise people to seek their like executive checkups or preventive checkups?
Okay.
Is there a certain age to that? Ano ba yung parameters? Ano ba yung isipin nila when they should decide to see a doctor?
Yeah. The mentality to actually go to a doctor only if they have symptoms is actually an old-fashioned mentality. Nung ninuno, back in our ninuno ancestors, yan yung mentality nila. If they feel well, they don't really need to see a doctor kasi added gastos and all that. The executive checkups, even as early as teenagers, you can already have your wellness checkup, because wellness checkup is not just any physical or condition, also psychological, mental conditions should be checked up, especially in this generation nowadays where this mental health becomes an issue. So as young as here in St. Luke's, as young as 10 years old, we can already start screening them for any medical condition, the lifestyle that they are exposed to now, a lot of unhealthy lifestyles, sedentary lifestyles with the online gaming and all the gadgets, fast foods available with just a click on your app, no? So these are all instantly provided to them, the access to unhealthy living. So as early as teenagers, we can actually already start screening them for certain common conditions and as well as any mental health issues that they may have nowadays. Now, for adults at any age, but the earlier that they undergo their wellness checkup, the better it is for them, especially those with family histories of certain conditions. So where you can easily catch them at an early stage or prevent, for example, if they have high risk for a certain medical condition, we can already start advising them on healthy lifestyle, nutrition counseling, weight management, the regular exercise. We can already start advising them as early as they consult to prevent these kinds of conditions with really a high impact in terms of complication, the quality of their life later on.
So I especially like the part about mental health screening. No? Kasama na rin pala siya.
Yes, kasama siya.
Very
especially
important.
in our
younger
population.
The generation
Yes.
below us.
Yes. Because they get exposed to a lot of things, especially online. They have a lot of, so we actually have those mga teen packages that they can avail.
That's good for parents listening to us to know na we have that packages in St. Luke's.
Yes.
Doc, what about how often should they do their executive checks? So you said earlier that there's no specific age as long as, especially if they have a family history of a condition or they just want to check, no?
Yes.
If they're not just feeling something pero meron na pala silang sakit na hindi pa nagpaparamdam. But how often should they be doing this?
Well, generally, at least yearly, the checkup. But if, let's say, for example, in your executive checkup, we find something, then that will be dependent on when the next checkup will be. So if, let's say, you have a cholesterol issue or a blood sugar issue, then they will start you on management. Then there will be some sort of more frequent follow-up than a yearly follow-up with the specialist already. Yeah.
So it depends on the results.
Yes, on the results of your executive. But generally, if your results are pretty good, it would be nice to do at least a yearly so you can see a progress. As you age, you'll see your progress in terms of how you control your metabolic parameters.
For those who have, for example, concerns about their weight or like they have a family history of heart disease, strokes, obesity, and they might want to check their sugars, their cholesterol, pwede na ba at the age of like 25?
Yes. We have certain packages, age specific.
Age-specific
Yes.
packages.
So we have the teen wellness packages, teenagers. And then we have the early adult packages that handles cardiometabolic packages for the heart and other metabolic parameters for cholesterol, for the weight. If there's a strong family history for, let's say, diabetes, we have a diabetes screening
I see.
or a diabetes package, which means for those who already have diabetes, what are the things that we monitor if
to
you already
prevent
have
complications
yes.
of
And then we also have for golden age, no, for
see.
older, yes,
For
yeah,
older-
for older age. So
older population.
basically more of age specific kind of packages, but we can also do customized packages for specific conditions. So if you're more concerned about weight management or if you're more concerned about diabetes, then we have specific customized packages for that one as well.
Okay.
Yes.
Doc, what can patients expect when they go to St. Luke's and subscribe or want to get one of these executive check packages?
Okay, so they actually can inquire about the reservation and any other information they might want. Everything can be done online for their convenience. Yes. So once they get the reservation and they come in, there's gonna be a whole journey already prepared for them. We have a in-house physician on duty all the time at wellness. So from the interview of the physician, they may also recommend additional tests to be included in the packages. And then they will start the journey already from the blood extraction and fasting procedures, which we always prioritize because patients come on a fasting state. After that, then they can already enjoy our very executive looking buffet. We have
After
that
my fast?
yes, after the fasting we have that for breakfast, we have a buffet for lunch and a whole different set of buffet for dinner. While they're doing their other executive laboratory procedures that do not require fasting, they can enjoy the buffet. Our lounge is also catered to those who are working while they're doing
So
their
they can
executive.
bring their
They can bring their gadget,
Okay.
work, have a meeting there. They can tell their personal nurses to say, hold on, I have a 10-minute meeting online.
Yung WFH is work from the hospital.
Yes, work from the hospital.
Work from the hospital.
Yeah, so
Okay.
we have those because we know how busy people are. So it's sometimes because of the online meetings and all that. So we do have that part in the wellness where they can actually have little privacy for meetings. So basically, it's a whole journey all the way till we discharge the patient if you're doing it as outpatient. The whole probably turnaround time from the time you get admitted in the wellness journey till you get discharged is about 3 at the most 4 hours. We do have the services also of the same day interpretation. If you want to have your results interpreted already on the same day, all you have to do is wait for a couple of hours, maybe enjoy the buffet again while waiting for the results, and then there's a physician who will actually give the interpretation of your results.
So before they find out that they have high cholesterol, naka-enjoy
Nakakain na sila. We
Naka-enjoy
have
na
our
sila.
carvings there. Yes, we have carvings
I should
there.
visit.
Yes, you
And then, Doc, di ba, everything is within the same area?
yes, it's a
They don't-
one-stop shop.
Yes.
One-stop
So
shop.
they don't have to keep on
Yeah,
going back
yeah.
different days
Or
scheduling their like ultrasound
Yes.
and x-rays. Everything is in
already, once they do the reservation, we already do the journey beforehand. So when they come in,
Schedule.
it's already scheduled which one comes first, which one comes next. Yeah.
So it's really more time efficient, especially
Yes.
for our busy
Executives
clients or
and clients.
busy patients.
Yes.
And I noticed also, Doc, that a lot of our patients would say that they're too busy to have this executive checks. Sobrang busy, whatever job you are in, like even us.
Yes.
Ang busy-busy ng buhay. So what can you say about that in terms of executive checks and busy lifestyles, or like just work in
Yeah.
general?
Well, sometimes you just have to tell them, yes, everyone is busy, but you have all this money because you've been working,
It's-
you get admitted for something severe, ubus kagad your inipon mo. So, prevention really is key. What's 4 hours of your time in terms of, getting a whole executive checkup just to prevent being admitted for 2
A longer
weeks,
time,
3
oo.
weeks of your laking time na natatanggal
Oo,
in
sila
your
talaga
busy
schedule.
schedule because siningil ka ng katawan mo,
Oo,
diba? Because
ayun,
you
oo.
abused it, you've been abusing. I mean, all this stress, the lack of quality of sleep and all that, no? That puts some stress on your body. And if you don't give your body proper care that it needs, sisingilin ka later on in terms of not only financial but also in your burden, mental health burden, emotional burden, your family pa. Yes, yeah, and all that. So giving up, well, not really exactly giving up, because here in St. Luke's, we actually have, as I said,
You can still
areas
work.
where you can still work. Yeah. But a few hours of that whole time that you're working is nothing compared to the long-term benefits you get when you do your executive checkup.
Thank you, Dr. Rowena Ejercito De Jesus, our specialist. Thank you for your time.
Thank you.
And for informing or giving awareness to our viewers for this World Health Day. Let's all take a step towards prioritizing our well-being and making proactive health choices. Stay informed, stay healthy, and see you in the next episode of MD in Focus.